You are Lavinia Winch, an ambassador for Yes Organic, which is a brand that sells personal lubricants, vaginal moisturizer, and intimal washes. And it's a British brand, but available worldwide, isn't it?
That's right. Yeah, I think we sell it to 90 countries worldwide.
Wow, so truly international now.
Yeah, global.
Yes, global. So yes, indeed, we're going to discuss intimate and sexual health in midlife tonight. Prior to becoming an ambassador, you were the medical liaison for 10 years. And you run workshops at Breast Cancer Haven on managing intimate health after breast cancer. You also write articles for magazines, blog for websites, and have been invited to speak at a number of high-profile events. And you shared with me that you're going to speak from both a personal and professional perspective, anything related to vaginal dryness and painful sex as menopause side effects. So it's a real treat to have you with us tonight. Thank you so much, Lavinia.
It's a pleasure, Severine. I love to be here and love to help.
Great, fantastic. So let's get started. Can you tell us about your current role at Yes and how it developed? As in, how do you go from being a medical liaison to becoming an ambassador for the brand?
Well, that happened because in about 2019, I think I was about 65, 66, round about then. And my husband was retired and I'd been working not full time, but very full on for 11 years at the SES company in this role, which was all encompassing in terms of attending conferences and being really the main person responsible for discussing and writing about the medical application for our range of products. Mm-hmm. And so I sort of thought about stepping back a little bit, but I absolutely wasn't ready to say goodbye to the world of women's health, the world of menopause, the world of sexual and intimate health. So I sort of really engineered the role and said, you know, how about being an ambassador? I mean, I had a sort of farewell party and everything, but actually I wasn't ready to leave.
That's the best type of job, isn't it? When you suggest a position that would be ideal for you and the company said, yes, let's do that.
That's right. So we think of ambassadors. I mean, I think we think of charity ambassadors and we think of ambassadors for brands. You know, so I sort of tend to think of drinks brands and things, they have ambassadors. And I am the Yes ambassador, but actually I think of it in a much broader remit than that. I'm an ambassador for women's health. And women's health obviously encompasses everything to do with pelvic health, vaginal health, vulval health, and sexual health. So, you know, I just feel so passionate about all these aspects of our lives. And that tied in with what we do at the Yes Company seems to be an amazing platform to be able to raise awareness, talk to women, and just share the really important information so that people have the knowledge.
Can you tell us more about vaginal dryness? Because it's one of the most common menopause symptoms, although it's only about hot flashes that we hear about and we talk about. So for information, vaginal dryness is not just during menopause or during the menopause transition. You can experience vaginal dryness after childbirth, after cancer, diabetes, and as a result of some medication. So tell us more for what is more perhaps specifically related to the menopause.
Yeah, I mean, I'm not a medical professional. So in terms of things like diabetes, I'm not sure the background and the reasons for that. But certainly breastfeeding and postnatally, that is to do with estrogen. And that corresponds with the same issues around about menopause. So the lubrication and the stretchiness of the vaginal tissue are down to estrogen in that part of our body. So our vaginal tissue and our bladder and urinary tract tissue all have estrogen receptors in them. So after childbirth, when you're breastfeeding, you're not ovulating, there'll be very little estrogen. And as we go through perimenopause towards menopause and postmenopausally, as our estrogen levels deplete, then that is when we can experience some vaginal dryness. And for everybody, it can be different. The symptoms can feel different to every person. Some people may not experience it at all. But for some people, it'll be literally a feeling of just sensitivity and dryness. For other people, it might be a little bit of stinging. It might be itching. They may think they've got thrush. And they may go to the doctor and be prescribed a thrush cream, because nobody talks about it. So we are totally aware of moisturizing our skin, particularly as we get older. And we don't think about this really important part of our body that is going to make a huge difference to our health and well-being if we can keep things in good shape and good order.
Yeah, definitely. So in your opinion, the only cause or the main cause is the variation in estrogen level. Or is there anything else that could highly contribute to this issue?
No, I believe, and I mean, I'd have to have that corroborated by a medical professional, but from what I understand, it is pretty well solely down to the estrogen depletion.
Okay.
That means that not only does the tissue become drier, it becomes thinner, it becomes less elastic, and that's why sex can also be painful, because that lovely stretchy tissue that we would have had when we were younger, when everything was very highly estrogenized, starts to change.
Absolutely. And is vaginal dryness and vaginal atrophy the same thing?
So vaginal dryness is a less severe form of vaginal atrophy. Atrophy, I think, technically means the drying out and the thinning of the tissue. So you may just experience a little bit of dryness, but if you actually are finding it really uncomfortable, that sex is really bad, that you're really in a lot of discomfort, and you go to a GP, you might well be told that you're being diagnosed with vaginal atrophy, and it's not a very pleasant word, and you probably look it up and think, what is it? I've never heard of it. What does it mean? It does literally mean the thinning and the changing of the vaginal tissue.
What would you say is the first line of treatment for vaginal dryness?
Okay, so the NICE guidelines, which were published in 2015 on the diagnosis and management of menopause, recommend that vaginal moisturizers and lubricants, non-hormonal, that is, so lubricants and vaginal moisturizers without any estrogen, would be the first line of treatment. Now that's really interesting, but what they don't explain is what is the difference between a vaginal moisturizer and lubricant. They come in the same sentence, and you see this probably on the NHS website, you see it in articles, you hear people talking about it, but nobody explains what the difference is. Would you like me to explain?
I'd love to. I was going to ask this question, but you're being so proactive, and that I'm going to ask it. So tell us.
I think it's really important. So a vaginal moisturizer is used to rehydrate the tissue on a regular basis over a long period of time. It can be used as often as is necessary, and you may not be sexually active. It may be just something that you're experiencing some of the symptoms. So there's no need to feel that you need it because you're wanting to have sex. So a vaginal moisturizer will be designed to release the water a little bit more slowly over a longer period of time where it's needed. A lubricant is for sex. It's for intercourse. It's when you want some lubrication right now, quite quickly, and to make sex much more comfortable and more pleasurable. And lots of people will be using lube or lubricants throughout their whole lives, just finding it that it's a much more pleasurable way to enjoy sex. But when you're suffering from a little bit of dryness, it becomes actually really very important.
So to use these products, you don't need to go see a GP. You can buy them over the counter. I mean, where do we find your products typically?
Okay, so yeah, in fact, some of the vaginal moisturizers and lubricants are available on prescription and also available over the counter. So of our range, we have a vaginal moisturizer, which is called the SVM. You can get that on prescription, but you can equally buy it over the counter. And that will be either from our own website, which is yesyesYes.org, and that's for organics, yes for organics, or it will be, we sell our products across Superdrug, Sainsbury's, Holland & Barrett, Ocado, and a whole range of independent health stores, and also some specialist pharmacies as well. You can also ask for it over the counter at any pharmacy, because it's on the drug tariff. They can actually order it from the wholesalers.
So when you say it's on prescription, I mean, we're talking here in the UK because I mean, I don't know if you know how it is abroad, but this conversation is mainly for UK-based women. So when you say it's available on prescription, does it mean that we have to pay for it, or it's free?
So if you're under 60, you have to pay for it, and it's a tiny bit cheaper, I think, on paying for the prescription than it would be. But it's not. I mean, our 100 ml of Yes Vaginal Moisturizer is £9.99, and that's a tube that will last you quite a long time. But if you're post 60 and you're not working, you're retired, and you don't have to pay for your prescriptions, then you should be able to ask your doctor, particularly if the symptoms of menopausal vaginal dryness are causing you discomfort and distress.
It's incredible. This symptom can start so much earlier, and then you have to wait until the age of 60 to get it for free. It's just unbelievable.
And unfortunately, because the NHS is always trying to cut costs, some doctors and some surgeries will say, I'm not going to prescribe it for you because you can go and buy it. Whereas if there are other medications that are only available on prescription.
Okay, and that's the one with estrogen.
Exactly.
So they're a bit stronger.
Yeah.
And you were telling me about your personal experience using products which cause irritation due to their ingredients. Could you share more about your experience to our listeners? Because that's an interesting story.
Well, because I'm so old.
You're not old. You're so much wiser. You have so many more experiences that you can enlighten us with what not to do so that we don't suffer the same way.
Well, so I had my first baby in 1980, and it was during breastfeeding, and when I wanted to get back to having sex after I'd had my baby, that I started to feel a little bit dry and uncomfortable, and I didn't really know why, but it seemed to be the normal thing to do, even in 1980, to send my husband out to buy some lube. And in those days, there was only KY. And so I presumed it was the only product that anybody talked about. It was used in hospitals. I presumed, as it turned out wrongly, that this product is very gentle, that it's very kind to the vagina, but actually it has ingredients in it, including petrochemicals and preservatives and things which can cause irritation. But I didn't know that. So I suffered after having sex, I suffered from soreness, itching, irritation. And of course I went to the GP and they said, you've got thrush. And this happened for, honestly, Severine, many, many years. And I didn't link. Nobody said to me, what are you using? And I didn't know that I just presumed it was a safe and gentle product to use.
So do you think it was actual thrush, or it was just irritation from the products, or due to the chemicals, the wrong ingredients?
I suspect that I might have had thrush from time to time, but on the whole, what would happen is if I stopped having sex, so stopped using KY, things would clear up, and then it was just like it was just like Catch-22. It happened all over again. Honestly, until 2009, when I met Susie and Sarah, the founders of the Yes Company, started working for them, and they explained to me about the importance of ingredients and how they'd formulated something very different. And I started using their products, and obviously that just changed my life completely.
Can you tell us about these ingredients that Yes Organic is using compared to the other one? Or let's forget about the other one, because we know it's not not as good or healthy it could be, but these ones are better.
I think it's important to know what the ingredients are that can cause irritation. So the main ingredient in most lubricants is glycerin. So glycerin is slippery, it's cheap, but it's a sugar. So that can actually also lead to thrush as well, because thrush candida feeds on sugar. So glycerin is known to be a mucosal irritant. So the mucosa is the tissue of the vaginal tissue. So in very small amounts, it wouldn't be too bad. But some of the standard products, such as KY, and I'm not going to mention some of the other brands, but the common brands that you'll find on the supermarket shelves.
At the moment.
After water, because most lubricants, the first ingredient will be water, but after water, if you look at the list, there will be glycerin, there will be probably propylene glycol, which is, I think it's a byproduct of petrochemicals. There are probably parabens, which is a preservative, which people would want to avoid because of this possible link with breast cancer. It's a whole possible estrogen mimicker or hormonal disruptor. So what Susie and Sarah did was they tried to find a base product that would be completely different, and they went to the plant world. So they spent 3 years researching, and our products are formulated with plant-based bioadhesive gums. So that's guar gum, locust bean gum, xanthan gum, and some aloe vera, which is moisturizing. And those are products that you'd normally find as a food thickener. So maybe a yogurt might be thickened with it, or a jelly, or an ice cream. And that's the base of our products in terms of our water-based product. We also have an oil-based product. I don't know if you want me to explain that as well.
Yeah, please do. Please enlighten us, because that's a type of research that we don't usually, I mean, most people wouldn't do, because it's time consuming, and we don't know what it means most of the time. And so please explain.
Well, I mean, it was really pioneering what Susie and Sarah did, and it still is. They actually patented the formula because it was so revolutionary, really. So a water-based product will get absorbed into the skin fairly quickly. You can reapply it, but it will always get absorbed after a little while. So what they wanted to do was to find a product that was longer lasting, richer, more luxurious. And so oil-based is plant oil-based. It's sunflower oil, sweet almond oil, and then a couple of butters, shea butter, cocoa butter, beeswax, which helps the consistency, and some vitamin E. And that is a brilliant product for anybody that is extremely sore. It's also really nice on the vulva if you're feeling a little bit dry and uncomfortable on the vulva. But it can't be used with condoms, because all oil-based products can deteriorate condoms. But it's a fantastic product as an alternative. And people have a sort of personal preference. They like one or the other, or you can use them both together.
That's good to know.
So that's a technique called double glide, and that is when you apply the oil-based first and the water on your partner, or the water over the top. And what happens there is the oil is giving you the protection, and the water doesn't get absorbed so quickly. So there's a much longer lasting, smoother effect. So those are the two lubricants, and the vaginal moisturizer has a very similar formula, but it's designed to release the moisture a little bit more slowly, and over a longer period of time.
Who do you think may want to use your products?
Everybody. Absolutely everybody.
That was an easy question.
Actually, Severine, this was an interesting thing. But when Susie and Sarah founded the company, they thought that they were just producing an organic pleasure product. And what happened was that they learned from customers that actually there was a huge medical need. So first of all, it was the women that had had breast cancer, that had had all their estrogen removed, and so they were suffering from dryness, and they didn't want to use a product with parabens. They wanted a really natural, organic, chemical-free product. So that was the first sort of customer base that we discovered. And then it was the menopausal women. That was the next biggest area where women were saying, we're suffering from vaginal dryness, and nobody has talked about this. We want a natural product. So that's when they realized that there was a medical need. And that's when we started to look at getting the product listed on the NHS, and going to medical conferences, and talking to healthcare professionals, gynecologists, and making sure that it was out there in the medical world. But it's still a pleasure product as well for everybody. So, we sell our products at adult sex toy stores like Joe Devine, wonderful Samantha Evans, who, if anybody wants to read any amazing articles or discover about sex toys for pleasurable sex during menopause, then Samantha Evans at Joe Devine is your lady.
Could you extend the range of products?
Yeah. So we've talked about the vaginal moisturizer. We've talked about the water-based and the oil-based. We have an intimate wash as well. But firstly, all of those products I've mentioned come in different ways of applying them. They come in different size tubes, and the smallest tube is only £5.99. That's the water and the oil base. They also come in pre-filled applicators. So if you prefer a single dose and you just want a little handy applicator that you pop in your handbag or you take away overnight with you, then you can apply it that way. Other people are quite happy to apply the products with their fingers. And then we have Yes Cleanse, which is an intimate wash. It's soap-free, paraben-free, glycerin-free, and it comes in an unfragranced or one with a little tiny bit of rose oil, organic rose oil in it, if somebody prefers that. And this is a product that some people will prefer just to wash with water, but there will be other people that like to have a little something to just a little bit of a foaming wash, and it needs to be very natural, and you should never use soap or harsh products, and also never douche, never wash out inside the vagina. This is only really for the vulva and externally. Severine, we also have an anal lube which is called Yes But, which is very popular. And we're also launching later this year an organic clitoral stimulant oil. And that's for people who might have difficulty reaching orgasm or just want to have additional pleasure. That's called Yes Oh Yes.
Ooh, wonderful. So do you know roughly when this year is going to come out?
I think it's going to be September, but we will make sure that everybody knows about it on our social media channels.
Right on time for Menopause Awareness Month.
Yes, absolutely. Absolutely.
So does it mean that all the ingredients are organic?
Yeah, I think it's about, so the oil-based has something like 98.9% or 99%, wow. And the water-based, I think, is 96%. All water-based products have to have a preservative in them. And also there's one of the gums that is not possible to get in an organic form. But being certified organic and also being a medical device means that we are hugely regulated. So we have to be audited by the Soil Association every year. The tracing of all our ingredients have to be absolutely regulated and monitored incredibly carefully. The laboratory where we have our products made has to be audited by the Soil Association. And in terms of the fact that we're medical devices, the directive, the medical device directive, is incredibly tough, and we have to have somebody in the office who's specifically dealing with regulatory affairs. So you can be sure that our products are well regulated, and that is not the same for some products that you might just pick up off the shelf.
What about your own menopause?
Yeah, so actually I'm really glad you asked that, because it's something, it gives me the opportunity to talk about something which I think is really important and is not talked about very often and not necessarily known. So what happened to me was, as I approached 50, and I have to say I knew nothing about the menopause. I remember my mum suffering from hot flushes. We were on a holiday in America. We were traveling in the car, and she kept rushing into air-conditioned shops in order to cool down, but she didn't talk to me about it, and I was really very ignorant. But I started to feel that I was getting urinary tract infections, so those sort of urinary symptoms. I didn't actually ever get it. I didn't remember having like a full-blown cystitis, but I felt, I just can feel the bladder feels a bit more uncomfortable. And so I went down the route that you would expect to go down by going to see a urologist. And the first thing they do is they want to look inside your bladder, so they give you a cystoscopy. And then they said, everything's absolutely fine, there's nothing wrong. So you're just sent away without an answer. Now, I was coming up to 50. It's a classic symptom of perimenopause. It goes along with the lack of estrogen. As I mentioned, the bladder and the urethra have the same estrogen receptors. So those symptoms where you think you might be getting a urinary tract infection, or indeed you may be more inclined to get UTIs, because what happens as your estrogen levels drop is your pH levels rise. There's a sort of symbiotic relationship between estrogen and pH. And as your estrogen levels rise, as your pH levels rise and become more alkaline, you are more inclined to get bacterial vaginosis or urinary tract infections or thrush. So it's absolutely classic, but I was not told that. So I had to do as much research, and eventually I went to see a urogynecologist. And because he understands both sides. He understands menopause and urology. He said, this is absolutely classic, and I think what we need to do is put you on HRT. So I was put on a patch, the transdermal type, which is great, because this could have been 15 years ago. So those patches were really quite new at that stage, I think. I think most people at that stage were taking oral HRT. I was given Vagifem, the topical estrogen pessary that in those times you only used twice a week. It was a higher dose. Now there's a lower dose, and actually you can use it more often. And I had to take progesterone because at that stage I still had a uterus, I had a womb. If only I had known, and that's the message that I want to get across to everybody, actually, to be aware of the whole range of symptoms in terms of vaginal symptoms. And that's why what used to just be called vaginal valval atrophy is now called the genito-urinary syndrome of menopause. So it's GSM, to include those urinary symptoms so that doctors understand and make the connection between those things. And sometimes just using a regular vaginal moisturizer can help those symptoms.
Were they your only symptoms?
Yeah, I never had. I mean, who knows what might have happened, of course. I can't tell because I was on HRT. So I don't know whether I would have gone through a much more. I certainly remember feeling less confident, a little bit more anxious, a little bit of depression possibly around that time. But I would say that the HRT really helped my symptoms and maybe helped me to go through without experiencing any of the other symptoms.
That's wonderful.
Well, I
That's
was
great.
lucky. I was lucky because I was very ignorant.
You worked really hard. You researched, you followed the route, go to the GP and get referred, didn't work. And then you decided to take that into your own hands and find a solution, which you did. And it worked for you, which is great. Which tip would you give to a woman going through the menopause?
Well, Severine, I think it's much, much easier now because, there's so much more out there in the media, on social media. And just today I was listening to PM and heard about the bill the bill that's going to go through the Houses of Parliament. Menopause, menopause is out there. There's plenty of opportunity now. There's some fantastic books. And I think educate yourself. Recognize what's normal for you. So if you're in tune with your body all the way through, so even when you're menstruating, pre-menopause, in your reproductive years, if you're aware of your body and you know your body well, then you start to recognize when things might change. And if you have read and if you have been educated to know what those symptoms might be, so that feeling of foggy brain, or I used to be able to walk into a meeting room and stand up and talk to hundreds of people, and now I'm feeling anxious about it. That's classic. And don't hang around, just recognize it and then start to look for ways. There are lifestyle changes that are really, really important. You can certainly go to your GP, but you don't necessarily have to go straight on to HRT. You can reduce your alcohol intake, increase your exercise, those sort of things, but just be aware. And then when you do go to the doctor, you've got the knowledge to work collaboratively with the doctor. So it's not them telling you what to do or fobbing you off. You can have a joint discussion about the best way forward for you.
And do you think that all GP have the knowledge now, or you need to go to a specialist menopause clinic to get someone who will carefully listen to you and have some element of answers?
It's very patchy. I think you can start with your GP. I think the really good thing to do is to find out if there is a GP in your practice who has a speciality or a special interest in women's health. And even better if they have some menopause training. If you don't get the answers, or you don't think you're being looked after in the way that you would like to be looked after, then you can look for a special menopause clinic. And I think what's happening, the menopause charity is offering a training to about 9,000 GPs who want to know more about the treating women through the menopause. So that is improving as well. But as we know, if anybody watched the documentary, the Davina McCall documentary, There seems to be some controversy about whether menopause is an obligatory course during GP training or whether it isn't. So, but you will find that the amount of training that some GPs have had is very, very little. So it's up to you in a way to try and find somebody who has had some training and does have a specific interest. And if not, there are specialist menopause clinics you can be referred to, and there are plenty of private ones, but that's a whole different story. That's not the way.
You wanted to mention the M word.
Yeah,
Tell us more about that.
Dr. Philippa Kaye is an absolutely wonderful GP, and she's written a book. I think it's the best book, and there are a lot of them around. And in terms of what to expect, everything you want to know about the menopause, she covers just about everything, and it's very well written. It's very clear. So yes, it's called the M word. Everything you want to know about the menopause, and it's by Dr. Philippa Kaye, and she has she's fairly active on social media, but she also suffered from bowel cancer at a very young age. So she has documented some of her journey as a patient as well. She's an amazing person, but I would highly recommend her book. And beyond that, if you're even more interested, there's a book called The Vagina Bible by Dr. Jen Gunter. That's an American gynecologist.
Okay.
So there's plenty of literature out there. There are plenty of leaflets. Newson Health, Dr. Louise Newson's clinic, she has a fantastic amount of leaflets. There's Lizelle Wellbeing, there's lots of information there. So really, if you look for it, there's a great deal of information.
Yeah, there's no more taboo about it. Everyone is discussing it, sharing their own personal journey, their own solution, and then it's almost like there's too much information. You know, what can I use from this information? But at least, you know, the word is out there. It's a great starting point. Who do you think I should interview next in this series? Someone who could share their wisdom.
Well, the people that come to mind immediately are extremely busy.
Okay.
Because they're practicing medical professionals. But I think the one that came to mind first when we're talking specifically about sex in the menopause would be Dr. Karen Gurney. Okay. I think her Instagram handle is The Sex Doctor. She's written a book called Mind the Gap, and it's about desire, because one of the things we didn't talk about is the lack of libido as you approach menopause, because of the fact that your testosterone levels are also lowering. And she is a really, really, I think you'd find her fascinating. She's an academic. She's written a brilliant book, but she does practice in London. So I would recommend her, or other person is Samantha Evans at Joe Devine.
Thank you so much for your time tonight. It's been a pleasure having you sharing all this wisdom. I have to say, I'm not very courageous in sharing all about intimate and sexual health. So it's great that you've been able to come and share all that with us. Thank you so much, Lavinia.
That's a pleasure.